So what if the mechanisms bringing fluid out of the leg are working fine, but there's just something blocking the flow? That's going to lead to a backup of fluid and increased hydrostatic pressure. I like to think about two big categories here. The first are things inside the blood vessel causing obstruction, and the second are things outside the blood vessel compressing the vein. So let's start with things inside the blood vessel. Clots and cancer are two big things to keep in mind here. But also don't forget vascular injury or surgery in the past, which can lead to narrowing or complete occlusion of blood vessels. Things can also compress the vein from the outside, blocking the flow of fluid, increasing hydrostatic pressure in the leg. This is a long list, with cancers, hematomas, and foreign bodies being just a few to name. There are two specific examples that I want you to keep in mind, though. The first is when you have severe infection or injury in the leg. All of that inflammation is going to lead to a lot of swelling, and that's going to increase the pressure in the leg. This pressure can actually overwhelm the pressure in the vein and cause it to collapse. This is seen in the compartment syndrome. The other example to keep in mind is on the left side of the body. Here, the iliac artery actually crosses the iliac vein. In some people, it does so in such a way to actually compress the vein and block the flow of fluid. That's known as May-Turner syndrome. So even if fluid is moving through the leg fine and there's no obstruction, remember we're still counting on the heart to be a reliable pump to help draw fluid out of the legs. If there's too much fluid for the heart to deal with, blood will back down into the legs, increase hydrostatic pressure, and cause edema. When we think about causes of too much fluid in the body, remember the big three: kidney failure, liver failure, and of course heart failure, which is a problem of not just too much fluid, but also dysfunction of the heart itself. So we just went on a journey from the legs to the heart to review things that will cause fluid to pool in the legs, increase hydrostatic pressure, and increase edema. That's the green boxes here. But now, let's look to see if the problem is not too much hydrostatic pressure, but not enough oncotic pressure opposing it.